Sammy, thank you for joining us here. We're here in Nashville, the AAPCP conference. You were there at the beginning. What a scene. We've grown from 100 people to over 350 people here at the conference. It's amazing. So I gotta ask, how did you get into physician compensation? What was your first job or gig here?
Yeah, so I kind of started in physician onboarding. I had done some billing roles, then moved on to physician onboarding. So I had kind of a fully encompassed kind of physician HR department. Did that for a couple of years. It kind of grew into, okay, we want you to do some job descriptions. We want you to do some offer letters. And then the hospital that I worked for had a very robust F&B process. So I was kind of asked to take that over because the person who was doing it prior to me was kind of trying to manage that with other responsibilities, and it just wasn't as robust as they were looking at. So that was kind of how I got my foot in the door, and then just slowly started doing all things physician compensation.
That is amazing. Everyone has a different story and how they ended up here. It is always typically random. When you go home at the end of the day, what does your family think you do?
I think they think that I pay physicians. I think they think that I'm like payroll. And when I try to explain that it's kind of essentially everything but that, they don't really understand that. So like, oh, she works with doctors.
Well, that must be fun. So if we're thinking about it, I know you just joined a new organization. It's fantastic for you. Congratulations. What do you plan on accomplishing in the next 12 months? What is the one initiative that you've identified and are going to focus on for the next time period?
Yeah, so I would say the new organization that I joined, everything's going really well. They have some really good systems in place. The one thing that I would like to work on, as well as the organization has really brought forward, is APP compensation. Our APPs are currently paid, I would say, more of kind of a staff type of compensation model other than those that are on production models. So really kind of moving that to the next level so that they're a little bit more comparable to their physician counterparts.
That's interesting. 2 points. That you have APPs within your umbrella. A lot of organizations maybe separate APP pay. So it's great that it's aligned with the physicians there. And then you can see APPs being used more in the marketplace there. And so they're being used as more independent providers. And so they're going to probably have more compensation plans that look like physicians. Are you all using value-based metrics or anything like that with your APPs, or is it more just a productivity model there?
It is just a productivity model. We are looking at, for the future, really trying to get one kind of value-based model for our entire workforce, physicians and APPs, so really kind of meeting organizational metrics, and it's just kind of a yes or no type of model. So relatively, I would say, lower percentage of compensation, but really just kind of starting to kind of get back in that door, but also be able to measure and be able to ensure that everyone is trying to achieve that same goal.
Nice. Is there a specialty or an area that you've seen that's been a little bit more challenging in the last 12 months that's maybe asking for new arrangements or recruiting challenges that you see in the marketplace?
Always CRNAs.
Yes.
And then I would say for physicians, I would say urology has been probably our biggest area.
That's interesting. And you're also out in the rural markets too. So a lot of the communities that you serve are in rural markets. Are there unique challenges in serving those communities and making sure that those patients have access to care and high quality providers?
Absolutely. I believe that Sanford is the largest rural health network in the United States, or at least one of them. So we do definitely have a lot of, kind of old school kind of primary care physicians who are doing maybe even FP with OB, doing clinic work, hospital work, ED work, nursing homes, coroner services, kind of all of the above.
That's it. I've always wondered, I always see the survey data that says family medicine with OB. I've never seen it. I've never met a family physician, at least maybe the places I go to don't have that. But it's very interesting to see that being a service line out in that space there. Where do you see the AAPCP in the next 5 years? Where do you see, not just the organization, but where do you see this industry going?
Oh, I definitely think it's just going to grow from here. I think it really kind of went from, kind of me being a one person, kind of department with really no one to turn to ask any type of questions, to now really having this whole community of people. And I think that it just becomes, more and more important each year with regulatory changes, physician fee schedule changes, with how that impacts physician compensation. So I just really see it growing from here.
Well, excellent. Sammy, thank you for joining me today. Appreciate your insights, and thank you for your contributions to the AAPCP.